I walked out to our receptionist Tara, and she handed me the patient's file. I remember thinking it looked pretty sparse. Even new patients usually have old records that were sent over or at the very least an emergency contact sheet filled out. The only thing in this file was a name and a symptoms complaint sheet. There wasn't even a date of birth. I remember looking at Tara but she just shrugged and went back to texting. She's a nice girl, terrible receptionist. I walked into the waiting room and there was only a young woman sitting in the corner. The first weird thing about her was she was sitting up straight staring directly at the door leading back into the practice. Most people have their phones out or maybe a book if they're older, but she was just sitting there, hands folded, looking as if she was waiting for me. I mean, I guess she was, but it was just odd. I walked over and introduced myself and explained that I would be cleaning her teeth today and she just stared at me. She didn't even blink. She just stared at me. For a second I thought maybe she didn't speak English. We have plenty of patients who aren't native speakers but usually we have a teletranslator sign on. I decided to ask her about one of the complaints on her sheet, general discomfort. I asked if she experienced while or brushing or eating, was there a sensitivity to hot or cold, and she nodded or shook her head at appropriate times, so I figured she was a little odd but at least I wouldn't have to try and make small talk while my hands were in her mouth.